Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and let's look into today's reports. Familial hypercholesterolemia can be treated efficiently with Inclisiran. Junk foods and unhealthy food habits are the main causes of a very high cholesterol levels among people. These habits are usually the root cause of severe cardiovascular, kidney and even metabolic diseases. Now, familial hypercholesterolemia is a genetic disorder and it is often caused by a defect on the chromosome 19. The defect makes the body unable to remove the low density lipoprotein LDL or even the bad cholesterol from the blood. The Uterine 4 trial in the Journal of the American College of Cardiology reveals that the pooled safety and efficacy data of Inclisiran when given twice yearly in addition to the maximally tolerated statin therapy with or without or the other LDL cholesterol lowering agents is an effective, safe and well-tolerated treatment to lower the cholesterol levels in adults with heterozygous familial hypercholesterolemia. Even atherosclerotic cardiovascular diseases or atherosclerotic cardiovascular disease risk equivalents are benefited with this. Abnormal uterine bleeding by anticoagulation therapy treated by uterine artery embolization. Abnormal uterine bleeding impacts quality of life and can often lead to premature cessation of anticoagulation therapy. Often when uncontrolled, even leads to hysterectomy. Approximations of over 600,000 hysterectomies are performed annually and an estimated 20 million women have had a hysterectomy, more than 1/3 of all the women who've had a hysterectomy by the age of 60. A recent study in the Journal of Minimally Invasive Gynecology brought out that data regarding uterine artery embolization to specifically treat anticoagulant-associated iatrogenic abnormal uterine bleeding, as it is a very limited data. The study reported that uterine artery embolization was an effective tool in the management of anticoagulation therapy associated with abnormal bleeding, resulting in decreased bleeding while allowing the continuation of the anticoagulation therapy with high rates of uterine preservation and even preserved menses. Alcohol consumption raises the risk of developing hypertension in men. Alcohol consumption has become a very common practice among teenagers, even aging to adults. It has reportedly given negative outcomes. Adverse effects are also being reported since decades. Various previous studies have already confirmed the harmful effects of alcohol consumption on the cardiovascular system, especially by elevating the blood pressure levels. Alcohol-related hypertension is a well-defined clinical entity with a comprehensive foundation based on a large number of studies. In a recent study, the researchers reiterated the fact that there is an association between alcohol intake and the risk of developing hypertension, especially in men. The study findings published in the journal Nutrition further added confirmation to its negative aspects, stating that increased consumption of alcohol beverages was positively associated with increased blood pressure levels and higher chances of developing hypertension, especially confined to the male population. Addition of anacetrapib to statins lowers the coronary events in atherosclerotic cardiovascular disease, the REVEAL trial reveals. Atherosclerotic cardiovascular disease is a common term for a group of disorders of the heart as well as the blood vessels. These disorders are the largest cause of morbidity and premature death worldwide. While coronary artery disease, that is the coronary heart disease, and cerebrovascular diseases are the most frequently occurring diseases, being the leading cause of world's mortality rate, several treatment methods are adapted for better management. The REVEAL trial in the European Heart Journal becomes the first randomized controlled trial to demonstrate that adding a molecule, that is cholesterol ester transferase protein inhibitor therapy, to the common statin therapy reduced the risk of major coronary events. The beneficial effects of anacetrapib on major coronary events increased with longer follow-ups, and no adverse effects emerged on non-vascular mortality or even morbidity. Carbohydrate counting along with the DASH diet beneficial in gestational diabetes. Gestational diabetes mellitus is one of the most common complications of pregnancies that has significant impacts on both the mother and her offspring's health. The dietary approaches to stop hypertension, which is the DASH diet, which is rich in vegetables, fruits and whole grains, includes fat-free or low-fat dairy products, fish, poultry, beans and nuts, and it limits the foods that are high in saturated fat such as fatty meats and full-fat dairy products. According to a recent study in the Clinical Nutrition, carbohydrate counting along with this particular diet is beneficial in gestational diabetes. The carbohydrate counting and the carbohydrate counting combined with DASH dietary interventions resulted in beneficial effects on the fasting blood glucose and 1 hour postprandial glucose compared with the control diet. The 3 dietary interventions, carbohydrate counting combined with the DASH as well as the controlled dietary interventions, produced similar maternal and neonatal outcomes in women with gestational diabetes mellitus. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.